You don't have the piece, Randy.
What piece?
To hook that to the RV pole.
We have, yeah, we do. She wasn't right there.
This.
Oh, yeah, they might be secret. There you go.
I got it. I'll pull it out of here.
Okay.
Well, I'll put it back.
I'm gonna set this over here with you. You know what? These are the humidifier ones. They look similar size.
In there.
You don't stick them with the humidifiers?
They're in there. They have a spot in there. Tell me when you're. Oh,
you're rolling. You're
I'm
live.
rolling. So we're going to put this clip onto the pole. And it stays there and it doesn't come off. It has to be above the kid. Not down here.
Gotcha.
Up here.
Okay.
Above the little twist.
All right.
The pump has a 24-hour battery.
Okay.
When you're at home, always leave it plugged in.
Okay.
It will screw on the back. There's a screw that goes into here. You use the screw on top to screw it into the pump.
Okay.
You can take it off, like if they go out, but the clip stays always to the pole.
Okay.
And it tightens. Leave it plugged in all the time when you are at home. The power cord goes into the side. It only goes in one way.
Mm-hmm.
And make sure it's always in.
Okay.
The feeding bag. You will get 30 feeding bags. You clean them out once a day. Throw them away once a day. Clean them out after every feed.
Okay.
Run water all the way through it to get all the milk, what's in there, so it doesn't spoil and basically do damage to the stomach.
Okay.
There's a clip on the bottom of the pump right here. You pinch it and pull it up. You have a rubber band piece going around it will only fit in one way. Pull it and stretch it in. And it locks right in.
Oh, that's simple.
Make sure you click this completely shut or it will not run.
Okay.
If it is out a little bit or this door is damaged, it will not run. Make sure it's just clicked.
Okay.
This part, they know where it goes. It goes into their extension. We can't even show them as RTs how to connect this.
Okay, but the patient will know.
The patient will know.
Okay.
To turn it on is your on button. You're going to hold it until it beeps and lights on.
Okay.
It's going to come up and say rate.
Mm-hmm.
We as RTs can't even set the rate for these patients. The nurses or the doctors will tell the family what the rate's going to be.
Mm-hmm.
But you can show them how to set it to whatever number they want.
Okay.
So this one, the doctors told me 30. So you just hit the plus button all the way up till 30.
Okay.
And then there's your rate button again, and it has a dose behind it.
Mm-hmm.
You're going to hit that again, and you're going to see dose come up on the bottom. You'll see it says 200 now. You actually want to set that in what's called INF, which is infinity,
Mhm.
which means that this pump is going to run until this bag is empty.
Mhm.
And it's going to stop, and it's not going to time out on the patient.
Okay. There we go. Okay.
And I always put it back on the rate. They don't need to change anything other than the rate.
Okay.
And that's going to change with the doctor, whatever they tell them to do.
Okay.
The volume total button is where they hit clear after every feed.
Okay.
On both of them. And then your clear button's up here.
Gotcha.
You are going to tell them to prime it. Once they put the formula in the bag,
Mhm.
your prime button is right here above your run pause button and underneath the on.
Okay.
You're going to have to hold that prime button until the formula gets all the way to the end of this tube.
Okay.
And that is to push so the air does not push into the kid or the adult.
Okay.
Because air going into a stomach is not good.
Nope.
Once it's primed all the way to the end, you hit run. And it's going to run until this is empty.
Okay.
That's it.
That's it.
That's it.
So super simple. All right, that concludes the training